Hello and welcome to part 3 of the infection control training. This is the part that will look at personal protective equipment. Before you undertake any task, you need to complete a risk assessment on the use of personal protective equipment. You can use the following as a guide. If there is no risk of splashing and therefore no contact with body fluid, then you may not need to use any protective equipment. If there's a low risk of splashing, so therefore there will be some contact with body fluid, it may be advisable to use gloves and or an apron. If there's a high risk of splashing, so contact with body fluids, then as well as the gloves and apron, you may want to consider using eye protection or a water resistant gown. The use of personal protective equipment involves you carrying out a risk assessment on the risk of transmission of microorganisms. This will be obtained from blood or body fluids. It is therefore advisable to wear gloves for all direct patient care, which includes hands-on or face-to-face contact, physical aspects of care including treatments, self-care and administration of medication. Gloves must be worn for all invasive procedures, contact with sterile sites and non-intact skin or mucous membranes, and all activities that carry a risk of exposure to blood, body fluids, secretions or excretions, or to sharp or contaminated instruments. Gloves are single-use items and must be changed between each patient and between different care or treatment activities carried out on the same patient. Gloves must be disposed of as clinical waste. In addition, other personal protective equipment may be required based on the outcome of your risk assessment for the task that you are going to carry out. In some cases, face masks and eye protection may also be needed if there is a risk of blood, body fluids, secretions or excretions into the face or eye. This may be the case when dealing with some spillages. Footwear should always be enclosed due to the risk of injuries. Therefore, sandals or open-toes shoes should not be worn within clinical environments.